We have, over the last couple of days, trained 433 healthcare providers and sensitized a further 790 across the county. Disease surveillance has been enhanced with new faces immediately reported to the county COVID-19 response teams for necessary action. This coordination has so far led to arrest and quarantine of 11 suspected cases who had their samples taken for testing. So far, results from 10 of these cases have since returned negative. The 11th one is awaited. We have commenced procurement of infection prevention and control equipment for healthcare workers to supplement what we have received from the national government. But I dare say that the status of equipment availability is still very much wanting. Personal equipment, preventive material is not there enough. Test kits not available. At our referral facilities, we have equipped our own intensive care unit, but looking ahead, should the cases arise, this definitely will be inadequate. To that end, I shall be conveying today at 11 o'clock to the national government through our technical committee that will have a teleconference at 11, the details of what we need in Kisumu County. And I hope the response will be positive. As the situation unfolds, there has been need to upscale our capacity in clinical case management. We have since increased the capacity of our isolation centers. So far, Jaramogi Oginga Odinga Teaching and Referral Hospital has gone from 5 beds to 20. We have also set up 5 beds as isolation units at all of the 7 sub-county hospitals, bringing our installed capacity to 65 beds. Plans are also underway to expand the isolation center at Kisumu County Hospital to 200 beds. In the wake of the rising need for more quarantine spaces, we have prepared a 128-bed quarantine center at the Kenya Medical Training College here in Kisumu campus, which can actually hold more should the need arise. But we are beginning these 128 beds fully equipped with ablution facilities for those who would be quarantined there. But since the training college has more bed capacity, we shall expand it as the need arises. We have also set aside Victoria Hospital as an isolation center for healthcare workers in the unfortunate event that some may need to be isolated from their fellows. As you know, healthcare workers run a lot of risk that may themselves be affected, and so we have a special hospital at Victoria where they will go to be taken care of also. We have also identified this Sunset Hotel as an operation center for frontline healthcare workers who will be taking care of the cases in the unfortunate event that we end up with such cases. We continue to ramp up our communication with mass SMSs on coronavirus prevention and control, currently being sent out to the general public in the county every day. Between today and tomorrow, we shall also be signing contracts with some of the media houses for certain targeted commercials, or what is called informed commercials and kits. Fellow citizens, this county is currently grappling with floods, terrible floods in Moroni, Nyando, Nyakach sub-counties. We have over 2,000 people displaced and housed in 5 active evacuation camps. This presents a new phenomenon, and these camps are themselves potential centers for the spread of coronavirus. So we have to deal with this situation. It requires very careful healthcare delivery systems and very thorough delivery of equipment that we should use in these places called evacuation camps where people are escaping from flooded villages. We have set up a combined disaster management team consisting of the county and national government officers. This team is already on the ground planning a response strategy. Indeed, they were in these places over the weekend and receiving their report now, and we shall implement the report that they give us. But this is a new demand on our resources faced with coronavirus. As a result of restricted movement due to coronavirus as well as current floods, the county is staring imminent flood insecurity. I want to appeal to our farmers to plant fast-maturing and adapted traditional vegetables and crops such as cowpeas, osuga, dek, olayo, oganda, and fast-maturing maize varieties and sorghum. I do believe that the Department of Agriculture is ready to provide seeds to the farmers to this effect. To address the issue of traders from the open-air markets, I hereby direct City Planning Department, the City Engineering Department, and city drivers to immediately report to work this afternoon here at sunset so that they can be mobilized to work in the markets of Kowino, Kusao, Nyawita, and Manyata, where we are taking open-air traders. Some of these markets still need ablution blocks completed and water. I have summoned the CEO of Kewasco here with me, and we'll be going to these places to make sure that water is available for the traders. It is very dangerous, ladies and gentlemen, for traders to trade in the open market. It is very dangerous because you don't know who is going to come and pick up things very near you. We can't maintain social distance in the open markets, but in the formal markets that have been built, as such places, Kosao, Nyawita, and Manyata, and so on, Kowino, we at least have enclosed places with proper facilities, and we can make sure that traders are trading safely, both for their lives and for those who come to purchase. So I appeal to all leaders at all levels, to work with us, and I appeal to the traders. We are doing this in their own good and in the good of the customers who come to purchase these commodities. We met with their leaders 3 days ago, and we agreed on an organized system of moving them to these markets. And I would just appeal to their passion, their conscience, and their commitment to life, to please work with us so that we can move to these markets and trade safely. I told them that the county government is waiving market fees for 1 whole month so that they can move to these markets and trade from there. We are prepared to lose revenue in order to save lives. So I do hereby appeal to all leaders to join us to make sure that these traders move to these organized places where we have proper ablution blocks, we have water and so on. People can wash their hands as they come. In an open-air market, it's very difficult to organize sanitation properly to prevent customers and traders alike from catching this terrible virus. Ladies and gentlemen, finally, we know that we have a curfew declared by the national government. The president himself declared it, that we leave public spaces, whether it be the streets, the shops, and whatever, and we go home before 7. Please don't wait until 5 minutes to 7 to begin moving from Kisumu City to Kondele or Kisumu City to Otonglo. You will not get there before the curfew. We are giving the security forces an unnecessarily difficult time by not behaving sensibly and consciously. So I would like to appeal to all our citizens and leaders to please, please, please abide by the curfew time, be home by 7 in the evening, wake up at 5, and begin the day properly.
So I'm appealing to all of us to take social distancing seriously. We are working together with the county government to see how we can help our traders, especially those dealing in food produce, because this is an essential service, to be in places which can be fumigated. The markets can be fumigated, and also we can have some level of enforcement so that we have a few people buying at a time. We don't want crowds. So we are appealing to all of us. Social distancing is for our own good. Coronavirus is not something outside Kenya. It is within Kenya. And we need to change our attitude and see how serious this pandemic is. We are appealing also to those in the informal settlements. Tafadhali tukifika jioni, tuende tu nyumbani. Tunajua kuna vijana pia wameamua sasa wakati wa curfew pia wanafanya vituko. Tumekuwa na visa huko Migosi. Tumekuwa na pia vijana ambao wanataka kuvuta bangi, wanangojea wakiona polisi wamemaliza kuzunguka kitu saa 3 hivi, wanafikiria askari bado hawazunguki, wanataka kusanyana mbele za maduka wavute bangi. Tafadhali, serikali imesema tukae nyumbani kuanzia saa 1 mpaka saa 11 asubuhi. It is for your own good. Watu wa pikipiki, watu wa tuktuk, munangojea mpaka imeshapita saa 1. Munataka kuona vile mutakimbizwa. Hii si mchezo tafadhali. Tuende nyumbani. Tuende nyumbani. Kuna wamama pia nakutana nao, bado wanataka kuuza, bado wanataka kupika. Tuende nyumbani tafadhali. Kutii imekuwa sasa ni balaa kwetu. Tafadhali tutii sheria. Tutii sheria. Na tumekubaliana kama County Security Committee, tukikupata tutafuata tu vile sheria inasema. Kwa sababu wewe ndio hutaki kufuata sheria. So kitambo tuanze kupelekana mbio, bado tunawasihi tuende nyumbani. Saa 1 ikupate nyumbani. Wazazi, watoto walitoka shuleni ili wakae nyumbani. It is our responsibility to take care of those children. So tafadhali wazazi, tuongee na watoto wakae nyumbani. Na tafadhali tunaomba mwananchi, kwa sababu tunajua kuna vijana ambao wanaleta shida hapa na pale juu ya usalama. Kukiwa na shida, tafadhali tuma message kwa nambari 988. It is toll free. Tuma message na utuambie ni wapi, tutatuma askari haraka iwezekanavyo. Kama kuna mtu ambaye amekaa nyumbani, alitoka ng'ambo, haja quarantine, tutumie ujumbe kwa hiyo namba